rural community, and we can't afford to be behind as healthcare moves forward. We chose an electronic health record because we needed one common chart within our medical group, and we also wanted to position ourselves for the future, knowing that to be able to interact with other hospitals, other groups, the government is going to be very important.
This organization is progressive, and we intend to stay as cutting edge as possible. We know as a community hospital that we have limited resources, and having the best technology available to achieve the efficiencies that we can with electronics.
We were replacing a current system. We had 16 providers that were on 16 different licenses, so 16 different daily closes, 16 different month ends. So I was looking to incorporate into a new practice management system to function as a multi-specialty clinic. When we selected Intergy practice management and an EHR system, it was integrated, which meant that especially the coding and billing elements flow from the EHR into the practice management system.
As an organization that is Joint Commission accredited, as well as Rural Health Clinic designated in 3 locations, and then patient-centered medical home designated, we're very reliant upon the solutions offered through Sage Intergy.
Software implementation process for Intergy practice management and the EHR really was not a difficult process at all. We rolled out by specialty. We started with pediatrics. We asked the physicians to select 3 patients from the first day that they would like to process electronically, and then the rest they were going to do on paper. The Sage trainer and then our educator were standing right by the physicians within the suite and walked them through those 3 visits. And then we let the physician determine, okay, the next day, day 2, how many charts did they want to do electronically. And I don't think we had anyone that wasn't 100% electronically outside of the first 10 days.
We are more efficient and more thorough in our care.
Well, I believe that we do a better job with diabetes because of our ability to use the flow sheet system within the EHR.
They come in for their diabetic recheck. I've got their A1C that's current in their current labs, but I've got all their last ones on quick recall. You know, they're in our flow sheets. We can look at them all side by side.
So the longer the patient is with you and the longer you've been populating those flow sheets, you really get to see a good picture of what's going on with them.
You know, with patient-centered medical home, the biggest stuff we're doing with it is, you know, tracking labs. We can track body mass, heights, weights.
And it's nice because you can actually pull a graph up for the patient, and then they can actually visualize what's going on.
You can look through their whole chart. You don't have piles of charts you're searching for anymore. You know, and now with, you know, being able to link to our lab system and hospital system too, you know, you can pull up anything you want to on that patient.
They have built in the growth charts for children, so it's made it easy for us to identify children that are outside of the 95th percentile for weight and growth.
With us being such a large multi-specialty group, the real benefit is when they go from a PCP within our group to one of our specialists. They're not having to repeat paperwork, they're not having to repeat their health histories. It's all there, and we all share the same chart.
With encounter notes, you know, the nice part with the site feature is being able to pull in all their old information, quickly updating it with the patient.
We are able to also generate a summary sheet at the end of the visit. I do that quite often for my elderly patients who we address a lot of different issues during the visit. It's, you know, making a summary sheet helps.
If you're sending out consults or you're sending the patient out to see somebody else, you can put their whole history in this one note. You don't have to send half the chart for your consult. You can just send that note plus whatever lab or image, and you've got everything they need.
It's nice that we're able to create the documents that the providers are really looking for to enhance their documentation.
The biggest change is just, I guess, getting used to the flow of information. It's completely different than paper charting.
Honestly, it does take longer, I think, to input the data with an EHR system than it does with a handwritten system. But I don't think anybody can argue that the product isn't better.
Once you really get used to the flow, you can really go through it much faster. You know, everyone always is really resistant to making change, but the nice part is I can read my notes now, which I can't say I could read them before, or anybody else could.
The access outside of the office has been really a good thing for us, especially when we're on call. We're able to pull up patient charts, look at tests that have been done, results from the emergency room, from home, from up in the hospital system.
Whether it's here at work or whether I'm at home on call in the middle of the night, I can pull up my EHR from home and I know everything about that patient.
In January of this year, our emergency room physicians were given the ability to look at the electronic health record in our medical group. So our ER physicians are able to look at the last visits, what type of lab work or radiology has been ordered, medication list, allergy lists, emergency contacts.
How critical when you've got patients coming into the emergency room with those types of situations that they have instant access to the most key information. It's at their fingertips.
They have done nothing but compliment us on being able to access that and have given us examples where they didn't have to reorder a test because it may have been completed recently and at their fingertips to look at.
Our physicians a lot of times will prescribe medications for discharge in the hospital right off from Intergy and send them electronically to the pharmacy, so that now we've, number one, the script is already at the pharmacy for the patient, which is so much more convenient. And also our charts in the office are already reconciled. We already know what medications they went home on because they're already on their medication list.
We're able to benefit patients by sending the prescriptions electronically to the pharmacies. The patients can, get to the pharmacy. It doesn't take them as long to get in and out.
It's literally a quick click of the button. If someone just needs a refill on their med, they're doing well on it. I think 3 clicks, it goes right to the pharmacy. It's on their computer screen as soon as it's offline.
In addition, we're using the patient portal, which allows them easier access to their healthcare providers.
They can communicate with us 24 hours a day. They have the ability 9 o'clock at night when they remember that they forgot to make that appointment during the day. They can go on the portal and make appointments or request the refills of their medications. They can contact the provider to ask questions.
That lets patients get very involved. They can email us directly by using that patient portal access.
The practice portal is a big part of our patient-centered medical home. It gives us the ability to keep in contact with our patients and for our patients to stay involved in their own care. When we went through the patient-centered medical home audit and we outlined the features that we had with the practice portal, the surveyors were very enthused about it, commented that it was one of the most fully featured portals that they had come across in all of their audits.
For our diabetics, they can just put all their most recent numbers in there from their glucometer. They don't have to call with it. They don't have to wait on the phone line. They can put it on there and I can take a look at that later in the day, email them right back and say that looks great, or let's make that adjustment.
The Intergy program is designed for us to document those certain pieces, whether it's for HEDIS measures. They're measures that are geared more towards pay for performance with certain payers, meaningful use. All of those are now starting to kind of come together and intertwine. So what you're needing for one to accomplish HEDIS measures, for example, a lot of that information is the same as what's required for meaningful use and patient-centered medical home.
I believe that we're meeting the meaningful use by virtue of the way the program is put together, but more importantly, I think it's allowing us to give better care to our patients.
We have actually participated to the degree that we can with all of our payers in terms of incentive programs, and the data being collected in the office and then being made available through Intergy has afforded us good opportunities for incentives.
Sage has definitely helped us a lot in managing our revenue cycles, especially with some of the reporting that we can produce from the system.
Financially, our days in accounts receivable are below the national average, in the low 30s typically, and we're able to, again, analyze every bucket, every payer, every class, where there might be anything that's affecting our ability to either bill or collect and interact with patients.
We examine copay and patient balance information on a regular basis, share it with our staff, look at trends over time, and actually set performance expectations.
And one thing that really excites me a lot about practice analytics is that it is extremely flexible. It gives you the option to pull information from practically any field of information within the electronic health record or the base practice management system. On a regular day-to-day, week-to-week, and month-to-month basis, we look at information out of practice analytics to review our revenue, to take a look at bad debt, to look at adjustments. We look at our RVUs and encounters. It provides a great amount of detail.
Is there one provider, is there one practice that is having a better outcome with diabetics or with childhood obesity or congestive heart failure?
We can present that information by our different departments. We can also show that information by individual physician.
Claims are more accurate and complete because the demographic information, the insurance information that we're gathering, and the steps that we go through at the time that we create the appointment and at the time that our patients arrive.
When we finish our charts and we go to the billing section, it kind of gives us some reinforcement that we have enough data in the chart or in the progress note in order to support the level of care that we've billed for.
There's continuity of care and better assurance that referrals and activities that took place from one office to another are completed.
The efforts we've given to the system, I think, have paid off in terms of us having now having the data into a system that can be accessed after hours and by the, when we're in the emergency room and at other places, that has allowed us to really provide better care for our patients.
This is kind of the wave of the future, but it's really now, for healthcare in terms of having everybody having access to their own healthcare, and quick access is the big key.
End goal is quality, and the only way that you can improve quality is if you really know what you're already doing.